Hi, welcome again to Hersco Online, your online resource for custom foot orthotics, custom shoes and orthopedic devices. In this section, we're going to take a look at external pedorthic shoe modifications. Some of the more common shoe modifications include flares, wedges, postings. So let's take a look at these individually. Adding flares to a shoe give it a wider base and make the shoe more stable. So you can take a regular retail shoe and then add material to either side of the midsole, extending it out medially and laterally. This has the effect of making the shoe more stable for the patient and will also help them if they tend to invert or evert. Providing a wider base of gait will prevent that rotation and give them the stability that they desire. A second common addition to the midsole of a shoe is to add a wedge. In that case, you're essentially going to post the shoe and tilt it up. So if the patient tends to pronate, you can add a wedge, in which case you provide material on the medial side to bring the foot closer to the neutral position. In the case where they supinate or they invert the foot, you would add the wedge to the lateral side. In more severe cases, where you're trying to control the foot, particularly in cases of ankle inversion, you can add a flare to the shoe that extends up past the welt and onto the upper itself. By adding material up onto the side of the shoe, you can really stabilize the foot. However, this makes the shoe far less attractive to the patient. The use of the out flare should only be used if there are no other choices for the patient. One of the very common adjustments made to a shoe is the addition of an elevation or a heel lift in cases where the patient presents with a leg length discrepancy. Adding a heel lift to the external part of the shoe makes it very easy for the patient to choose a shoe that fits them internally, and then all the adjustment is made to the outside. Crepes or neoprenes can be layered up to make the shoe the correct height and bring the patient back into balance. We're all very familiar with rocker soles as an external addition to the shoe, and these are very helpful in cases where a patient has no motion at the ankle joint, perhaps has a metatarsal fracture, or has some form of limited motion such as hallux limitus. The addition of a rocker allows the patient to ambulate more smoothly and can be used specifically to prevent flexion at critical joints. There are many styles of rocker sole. They can include forefoot rockers, heel rockers or rollers as they're sometimes referred to, and cam rockers where you get a smooth rocking motion from the heel straight through to the toe. In cases where you're trying to prevent flexion, you can also use sole stiffeners which can be added to the midsole of the shoe. In the olden days, they used to use steel spring. This was added to the midsole of the shoe and then the outsole was layered back on top. Nowadays, it's possible to use thinner and lightweight carbon graphite materials, and these can be added either to the midsole of the shoe or also just placed inside the shoe underneath the sock liner or the insole itself. Finally, in cases where a patient has drop foot or they tend to drag their foot, it's possible to add a toe guard to the shoe itself. This is a guard of a thin, harder plastic material that prevents the patient from scuffing the toes and sometimes even breaking through the upper leather so that the shoes last longer. These are some of the many modifications possible with regular store-bought shoes. And if you go to our website, hersco.com, click on the Education tab. There's a fuller description of these and more on the article Pedorthic Shoe Modifications. Thank you once again for joining us at Hersco Online.